When health insurers merge, consumers often lose. A wave of mergers in many sectors of the economy over the last several decades has significantly reduced competition and hurt consumers. That's why the lawsuits filed last week by the Department of Justice and state attorneys general in federal court challenging two big health insurance mergers were so important. Antitrust officials say Aetna's $37 billion acquisition of Humana and Anthem's $54 billion purchase of Cigna will reduce the number of large national health insurers to 3, from 5 today. That would lead to fewer choices and higher premiums for individuals and employers in places like New York, Los Angeles, and Kansas City, Mo. The mergers could also hurt doctors and hospitals, because they would have less bargaining power against the larger insurers when negotiating reimbursement rates. These two proposed mergers are the culmination of a series of deals in the healthcare industry that have reduced the number of insurers and caused the consolidation of hospitals and doctors' practices everywhere. Every merger seems to compel another as competitors bulk up, lest they find themselves with less leverage in negotiations between insurers and providers. Health industry executives, including those at Aetna, Humana, Anthem, and Cigna, have typically defended these mergers by arguing that they are necessary to make the healthcare system more efficient. They also say they allow doctors and hospitals to better coordinate medical care by, for example, having different specialists working for the same hospital or covered under the same insurance policy, something they argue is encouraged by the Affordable Care Act, the 2010 health reform law. Aetna and Humana and Anthem have said they will fight the antitrust suits, which were filed in the United States District Court for the District of Columbia. Cigna says it is evaluating its options. There are clearly benefits to better coordinated care, but that does not justify all of these mergers. Coordination can often take place without concentrating so much market power in the hands of a few companies. And rather than making the system more efficient, recent research has found that increased concentration has driven up the cost of health care. One 2012 study published in the American Economic Review found that consolidation in the health insurance industry between 1998 and 2006 was responsible for a 7 percentage point increase in premiums, or about $34 billion a year. And a study by the Robert Wood Johnson Foundation found that hospital mergers also increase costs, sometimes by more than 20%.